Namaste. This is JV'n Dr. MEENAKSHI, SONI, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH, Women's University, Jaipur, Digital version 2.0. This is part 4, part 4 of Miasm classification and its concept. Today we discuss syphilis. The syphilitic miasm has virulent open ulcer. Ulcerated skin with pus and blood represents syphilis. Irregular arrhythmic pulse is syphilitic. Destruction and degenerations denote the syphilis. Melancholic, depressive, and suicidal tendency is syphilis. Syphilis produces destructive disorder, which means manifest as perversion, suppuration, ulceration, and fissures. Necrosis, ulceration, periodic alertness, putridity, acridity, these are the syphilitic miasm. Syphilitic persons seem to have one emotion only, the urge for the destruction. जितने भी syphilitic miasm वाले पेशेंट्स मिलेंगे आपको उनमें सबसे एक प्रोमिनेंट सिम्टम मिलेगा कि उसका जो नेचर होगा वो डिस्ट्रक्टिव होगा या तो उसकी बॉडी में कहीं पे डिस्ट्रक्शन वाले चेंजेस हो जाएंगे जो पैथोलॉजिकली होंगे या फिर उसका जो नेचर होगा उसमें आपको वायलेंटनेस डिस्ट्रक्टिव नेचर ये सब आपको सिम्टम मिलेंगे दे लैक एनी सेंस ऑफ रियलाइजेशन एंड ड्यूटी एंड अंडरस्टैंडिंग syphilitic are the committed crimes and cold-blooded murderers. They suffer from a vitiated mentality. The destructive syphilitic patient has no love for other life and no love for their own life also. Either destroy themselves or kill others. They can be both suicidal and cold-blooded murderers. Syphilitic lack mercy and sympathy and may be called iconoclast. Forgetfulness is the syphilitic. There is a kind of mental paralysis. The patient may read but cannot retain the information. The mind is slow. The syphilitic patient dwell on suicide, has suicidal thoughts and the dreams and experience the urge to commit suicide. Love for their own life is just destroyed. When syphilis is coupled with psychosis, it becomes the basis of the most suicides and the criminal inanites and a preponderance of syphilis results in. The syphilitic lack of realization result in the patient who are unlikely to deprive other for their own benefit. However, a criminal, for example, will not realize the impact that his time in prison will have on his family and is therefore selfish only in the sense of being focused in one particular direction. The syphilitic patient, with their destructive impulses, tend to forget or ignore other responsibilities. The introverted, close-mouthed syphilitic patients keeps their depression to themselves and it only becomes apparent after they have committed suicide. They have a tendency to suppress and conceal and an inability to realize and express their symptom. Any true form of expression is lacking. Syphilitic have a desire to escape from themselves as well as from others. Their own idiocy, ignorance, obstinacy lead to melancholic and gloominess. A desire for solitude can lead to depression and melancholia, resulting in the suicidal impulses. Syphilis attacks the guard and is hired criminal. These patients fail to realize that if they are caught, they will be sent to prison and that there will be no one to look after their family. Syphilitic patients cannot remember the recent happenings but can recall the past events in the chronological order. In Organ of the medicine, syphilitic miasm, mentioned in aphorism number 79, and the origin of the syphilis miasm is from the venereal disease that is given by Dr. Hahnemann. So the mode of infection of syphilis miasm is the impure coagulation, same as the psychosis. Develop the primary manifestation of the syphilis. The primary manifestation of the syphilis are the formation of cancer in the genitalia, and when it is destroyed by corroiding and the cauterization, so it developed the bubo. Bubo, after developing the bubo, it convert in the secondary manifestations of the syphilis. And the secondary manifestation can develop the any type of the disease that is conduct a pathological changes in the body. So the syphilis is completed. There is some expressions of the syphilic miasm: anger, violent anger, depressive, melancholic, and have a tendency to suppress. So the topic is completed. Hope you are satisfied with my this session. If you have any query, please mention in the comment box. Thank you.